So the high points of the budget are personnel services or personal services, materials and other services, and then of course, any public safety center move in the future. There is the budget. It is in your budget book as well. I'm sorry, I did not write down the page, but it is on the screen to walk through. So our previous allocations with the county was a $263,000 obligation. And you'll see a $162,000 increase for the FY27 budget, which is $425,000. A bulk of that is in the 5-1s or the personnel costs. The plan is, upon the budget approval and starting July 1st, we will post the Director of Emergency Management. I'm currently operating as the emergency manager for the city, but the plan is to hire somebody with an extensive background in emergency management certifications and get somebody who's really credible. That salary point is it's in the higher end of the range for that classification. And then we would like to hire a grants or a fiscal compliance assistant. Lots of finances, lots of reimbursements, lots of very nuances that have to do with the financial aspect for emergency management, and so having that position in there and having that person with that kind of intimate knowledge is essential. And then a senior administrative assistant, which we were able to allocate in the latter part of this fiscal year, and it's currently Monica Skowcheck operating in that position, and the plan is just to continue that administrative assistant as well. And then you'll see office supplies, training, and computer equipment. A lot of this mirrored what we were already contributing to TAMA. Some of it's a little bit higher, and then a capital cost of a vehicle, which is a Ford F-250, similar to what asset management drives. Lots of equipment to get around, need to make sure that there's a reliable response vehicle. The previous director was driving a Chevy Tahoe. That was retained by Tulsa County, so we do need to purchase an emergency manager, a vehicle, and we need something that's reliable and can get through all the potential disasters that we have here in the city. I talked a little bit about the positions. We will retain the siren system. It's all on the same network. We currently have 108 sirens. Very few of those are in the county, but because they all run on the network system, we will manage those internally from the city of Tulsa. And then I just have failure to prepare is preparing to fail. Preparedness is the #1 thing, obviously, for emergency management. We can't think every possible scenario, but being prepared for it and having a team that's ready to respond is the most important. So I will open it up for questions.
Okay, very good. First of all, we have Counselor Archie.
Thank you, and thank you so much for the work that you do in all of your jobs.
Thank you.
And I think we were talking in the last meeting about giving you some more.
Yes.
And, yeah,
10 more
Please.
departments.
but
Please, I welcome them all.
you can handle it. Okay, so the last emergency that we had, or that I recall, we had some tornadoes, or there was some damage. 33rd and 81st, we texted back and forth. It turns out that I think it was Sepulpa. The damage was done in Sepulpa, not in Tulsa. And yes, we care about Tulsa, not Sepulpa. No, we care about Sepulpa very much. But the question is, what sort of access or collaboration will you have with Creek County or the city of Sepulpa, just in case we do want access to those reports to communicate, for those who have districts right on the boundaries?
So, great question. Emergency management, as we know, especially with natural disasters and whatnot, don't contain themselves to specific geographical boundaries, right? So, relationships are very important, and coordination with other emergency management, and that's part of the layers that go into it, is local, state, and federal, and how they all operate together. So not operating in isolation, but really working with, right? So coordinating what the emergency mitigation plans are for each jurisdiction, especially those that we're adjacent to, others in the state that we might work with. And then, of course, all emergency managers operate under the NIMS system, right? So it's a standardized structure for incident response. And in your case, Counselor Archie, I will say that, you know, one thing we've really been working on is a communication plan and trying to make sure that everybody knows and is aware of what the potential, you know, whether it's bad weather coming in, whether it's damage assessments after the fact. One of our challenges as well is everybody's out there taking pictures and putting them up on social media, and so that response is very immediate when we are controlling the situation that could potentially be ongoing. So it may appear sometimes that we're behind the curve or we're not aware of what's going on, but we do monitor that, we do keep our reports in, and so I think that's one of the challenges, but our goal is to obviously keep all of you informed and aware and up to speed of what is, what's going on out there, what has happened out there.
Well, I know, I appreciate that. You talked about county and state, city divided up, a bunch of stuff. Who got more, Tulsa or Tulsa County?
I think it was based on needs. I don't know who got more, but it was an equitable split.
Oh,
So if there was more of actual physical assets going to one entity, then there was a bigger cash portion. And it also was based on, the city always paid a little bit more. We paid about 53%. And the county paid 47%, and so there was a division based on that. So one of the grants, I know the county used a portion of the grant to purchase some equipment, so the remaining balance came to the city of Tulsa. So there were,
Okay, ways to sort of divide it up
Yes.
equitably.
yes.
Thanks. Thank you.
Counselor Gilbert.
Again, I will echo the gratitude of everything that you do.
Thank you.
You have a lot under your umbrella, so, and you do a great job with everything. I'm just curious, why the split? Why did we split with the county? And why are we doing duplicate services?
So I think this is, I understand the concern. We know it was about a year ago that the previous director,
Yeah, we're all aware of that
And I
situation.
But they have who
In the
seems like a
top-
qualified
in the top,
successor,
yeah.
right? So,
I'm sorry,
but they have like so with all the right credentials, et cetera. Without that, who's there now?
that was the county hired that
Right,
person, right?
right.
So, but that incident opened some doors on some conversations about, moving forward and some things that were really kind of not working to, or necessarily in the city of Tulsa's favor, right? And I addressed some of those about being very specific to what our needs are. And I can get into those more so, but like, we have first responders that go to the city of Tulsa and are on the scene. So when we have our first responders, we always have an incident commander that's in the same structure that's reporting to up through the same emergency management. We can tailor our risk mitigation based on what our needs are. Urban areas, city of Tulsa areas have different needs than more, rural type county areas. I know that there was, somebody had told me that there was one time that the former director was out in Jinx dealing with an emergency, and there was something in the city of Tulsa that also needed it, and so there was a neglect to the city. It allows us to improve our resources, like what is specific to us and our needs in the city, as opposed to what the county might need based again on what their different demands are based on their different, we've got urban fires, they've got more,
Cedar trees on fire.
thank you, fires, yes. You know, and I think one
Emails.
big thing for us was direct control and accountability as well. I mentioned that in the beginning. One hurdle that we found with the previous director was payroll was coming out of county, but they were maybe subject to the policies and procedures of the city of Tulsa. There was, it wasn't clearly delineated how there was accountability, and so if there was potentially an investigation or an HR investigation into any of the allegations, where did that path was really kind of just really undetermined. And then it took obviously a joint agreement between the mayor and the county commissioners, and if there was a differing opinion about something, how does that all work out? And then it's just direct control, working for the elected officials, the senior officials of the city of Tulsa who represent their constituents directly, and not having to also involve the Board of County Commissioners.
So you said that there was an incident that happened in Jinx that the director was more focused on as something else was happening in Tulsa and neglecting Tulsa. Can you go a little bit more into what that was, just so that we have a better understanding of why we need to have that split?
I don't have the details on that specific one.
Okay.
I know that was brought up at one point, but I didn't ask for follow-up details.
Okay.
I wasn't there and I wasn't part of that.
Also, the sirens, how is that going to work? Because if we're having the split with Tulsa County, we have a tornado coming in East Tulsa. It's borderline between Broken Arrow and East Tulsa. Who calls the sirens, or who sets the sirens? Is it going to be Tulsa? Is it going to be Tulsa County for Broken Arrow? What happens in that type of situation?
So the tornado sirens are set to be automated based on the predictions from the National Weather Service. And there are key thresholds that trip those sirens going off. And if at any point, and I've said this at this table before, the National Weather Service drops a polygon, which is either rotation is detected or wind speeds are at a threshold, I believe it's 70 miles an hour. It drops a polygon. If any of that polygon touches the city limits of Tulsa, the city is in 4 quadrants. That quadrant sirens will sound. So if the polygon is dropped over the city in East Tulsa and Broken Arrow, both sirens will go off.
So who is setting off those alarms? Is it us
They're
or them?
automated through the network to go
Oh,
off.
so the
Were they
National
always
Weather.
only
Hold
automated
on,
from the
yeah.
county?
So the National Weather Service is the one that will set them off?
No, once the networks talk, so when the National Weather
Yeah.
Service says there's a tornado on the ground, it talks to the network and sounds the sirens, that it is supposed to be automated and go off. There are redundancies that if that doesn't happen, we can push a button, I say that in a very elementary, way of saying that is, we can activate those from the EOC, we can activate those from a remote location, and the final redundancy is 911 has the ability to set those off as well. One thing we came up with as we were kind of working through this whole process was that James Plumley, for 7 years, sat at the EOC every single time there was severe weather. He was the only person that knew how to set the sirens off, that if the automation didn't work. We have trained 15 people between police, fire, other folks
First responders.
to be able to be in that room, so we don't have to depend on one person to do it.
Right,
So,
yes.
Okay.
I just want to have it clear that where the boundaries are of our sirens as opposed to Tulsa County. I mean, because that's part of the split. So, you're not gonna be pushing the button if a tornado's gonna be hitting Broken Arrow.
correct, unless it touches any of the warning touches the city of
Right,
Tulsa.
but we're so close together, and with Counselor Archie bringing up Sepulpa, it just made me think about, well, what about the borderlines of the suburbs that we touch? I mean, and Jinx as well.
I think the likelihood of a tornado being so close to the city of Tulsa and not touching the city of Tulsa is a very rare opportunity. So,
I mean, I think there's been plenty of East Tulsa tornadoes that have been right there on the border of Tulsa and Broken Arrow. These emergency management employees, how many were there again?
we have three.
One's current though, one's already on.
Full-time?
Yes.
What are they going to be doing when we don't have severe weather? I mean, I asked this question earlier in our 1 o'clock, and I was told to ask you during this meeting, sorry. So,
Mike?
Mike is the one.
Mike is the one.
blame him. He didn't want to ruin your,
So, emergency management is much bigger than just weather.
oh, I know. We're
Thanks.
talking about droughts, we're talking about fires, yes.
Health
Levies, maybe?
issues,
Levies?
flooding.
So-
We're talking about, potential, data breaches, we're talking about potential
Social unrest.
terrorist organizations. I mean, they do help on some large-scale special events as well. There were 4 full-time employees at TAMA, I believe there were 4. There is, training, certifications, like I said, there's a nuance on financial impacts. We have started with the administrative assistant. Monica is working on helping build this up, but she is also helping in other public safety aspects. She's housed up on the 15th floor. She is more than willing to go to work and do what's needed for her, so she has been a great help. And because police, fire, even animal services, we saw it with the cold weather, all touch on emergency management, and so utilizing her in those kind of capacities to help out has been very helpful.
So you already have a person in place for as the director of?
No,
Or
I have
the
the administrative
administrative-
assistant
Okay.
in place.
Okay,
We will hire the director this summer
yeah.
after
yeah.
the fiscal year comes out, or the budget, yeah.
So is that, are people applying for that, or is
We-
it?
So we will work with Human Resources to develop an announcement. We will post it internally, just like we do every other City of
Right.
Tulsa position. And it's a merit-based system for selection, and if nobody internally is a qualified candidate or gets certification, then we will post it externally. I am confident we can find somebody that will do just as good a job, if not better, than we've had in the past.
Okay, but it will be, open for everybody within this, that works for the city of Tulsa to apply for it.
Absolutely.
And if you don't find somebody within that pool, then you will outsource it, that application
We
process.
will post it externally with
Yeah.
the processes that
Okay.
HR has in place, yes.
All right. That's all I have for now.
Thank you. Counselor Bellis.
Yeah, a few questions, I think. Hold on, writing down another one. No, going back to you mentioned some of those reasons for splitting off and it having to do with making sure that we're getting the right kind of focus, and concerns about accountability and things like that, which I could definitely understand, though I know it's we're standing up a whole department, so that's a lot of additional cost to us. So I'm just trying to think about what gets us, of course, the best service. And I'm curious, was there a look at renegotiating the contract to add in more accountability markers? I just wasn't sure if there was kind of a longer process before deciding to make a split.
There were conversations about what that would look like. I know that there was a joint HR investigation that was done over some complaints and some issues that were going on at TAMA. I think it was just, there wasn't a lot of alignment between the two. And I think there was just really we're gonna go in different directions and have, take these in different approaches. So I really didn't feel, and I kind of got the impression after meeting with the county commissioners, I don't want to speak for them, that was a joint, consensus.
Okay, that's helpful. Is there, related to, and this might just be in 1 year compared to the next year as you guys kind of staff up, are there, because I know there's so many certifications and things that are part of doing emergency management across, per your point, all sorts of different types of emergencies. Are there trainings and certification costs built into, like, to both years, or?
Yeah, so the budget does have some training in
Okay.
it. My goal is to obviously bring in an emergency manager that's got all the certifications and credentials. But yeah, training and recertification's a big part of that.
Yeah, because I know that, I'm just, because I wasn't sure with some of the things that we were cost sharing before, or that might have been a cost burden more on the county than us, like where some of that, you know, per your point, there's like equipment things or some of that. I think it's hard to wrap my mind around, like, you know, where, if, you know, we're paying more and getting better services, or, I think right now, especially because we still need to staff up, like transparently, it's kind of like, we're spending maybe a bit more on the trajectory too, and might have reduced services to some degree. You said, so you have an admin assistant right now?
I do.
What bucket of dollars is that one out of?
It is in an emergency management, is what,
Okay.
so some of the money we've recouped from county, we
I see.
have identified or built it, and so.
Okay, and then you mentioned, you know, like the audit for the sirens, which I just like, there've been some like one or two wacky siren experiences people have had, you know, it happens. You know, it wasn't like the same as like that time in Hawaii where I got text messages, so could be worse. I was curious though, you mentioned that there's like this automated aspect. For what was happening with the county, do we know, were sirens, like, were they letting it be automated National Weather Service monitoring, and then that automated, okay, the siren's gonna go off if this, then this? Or were there people also actively monitoring? Like, I just wasn't sure if it were always like the National Weather Service do that and pass it on to us, or are there like people on staff, or had there been people on staff at the county who are also actively monitoring? Because I know for instance, like the Father's Day storm, it's not like anyone saw that coming, or you'd need much more micro attention to have caught that.
Okay, so I'm gonna try to get all
Yeah.
your questions.
It's
If
okay, I can go back to
if I miss any.
But yeah.
I'll address your text messaging.
Yeah.
And we are working on a communication structure.
That's good.
I know that is something that Monica is working on, and we have tried to send out those slides, and I have asked that if those are not if there's more information that you want, please let us know, because we are building that. I know VOG is to go out, I know Everbridge is to go out, we are exploring what those options are going to look like, and once we get the department, you know, staffed and running, we will have all of that in place and be sure to let you guys know what that looks like.
National Weather Service automation.
National Weather Service automation, so.
I just wasn't sure if there was more specific monitoring that was happening separately from letting that automation play out.
Yes, so
Okay.
when I say that they're automated, so we've had several so far this year. It seems like we've had an early spring with our weather. When there are not just thunderstorms, right? We live in Oklahoma, we have thunderstorms, but when there are elevated threat levels of potentially damaging winds, lightning, hail, tornadoes, I don't wanna say activate, because that's a different level.
I know there's different levels of, yeah.
We will monitor. So we have had folks in the EOC during these events. I was there Friday evening when the big hailstorm rolled through. There are, the ability to actually push
Yeah,
the
okay.
button is in there, right? So we've got National Weather Service conversations. One of the big things is there's a Slack channel with a lot of communication that goes on, and there are the notifications of we are going to issue. So when Counselor Archie's example about the West Tulsa, we are issuing a tornado warning for Tulsa County. So we were like, all right, here we go, make sure that the automation's working, and when it's not, then you need to, you know, take the measures. But there are folks in the EOC, it's a very small contingency, but it is usually an IMT person from the police department, Bill Smiley from the county, and typically Darren Glodo has been in there from 911, and then fire has representation as well. So that's not a full-scale activation.
Yeah.
I would invite any of you to come down and look at that if you're more curious about what it looks like during a storm, maybe potentially this weekend from what we're looking at Saturday. But I'm happy to show it to you. And then a full-scale activation, of course, is the room is full and.
Right. That's helpful, because I was curious, you know, I know we, like, with federal cuts to the National Weather Service, and their, like, monitoring teams like, I know they have reduced capacity too, so any, like, you know, it's reassuring to hear that there's also those kind of contingencies and necessary kind of like built-in resilience things for being able to activate something if we notice something that maybe they haven't caught. That's what I was kind of concerned about. I also, it sounds like, though it's helpful with the context that there was kind of maybe like this mutual agreement to split at that time, though part of me is also hearing, right, as we're getting ready to staff up now, I'm kind of, could you offer some reassurance to me that for the past year, we haven't had significantly reduced capacity for emergency operations? It kind of sounds that way.
No, I
And
am,
so, okay.
I am very confident
Okay.
that we have had the right people in the room and doing the right things.
Okay, that's, okay.
We have, so, yeah, between police, fire, you know, the folks that we've got, I am extremely confident that we've done met our need.
Okay, that's good
And
to
moving
hear.
forward until we get this fully stood up, then I am confident as well, Counselor.
Yeah, okay, no, that's really good. And then, okay, so from what you were mentioning, just as a last question related to the, like Slack messaging thing, so we are still in communication with the county's team, like, you know, all the different area management organizations are talking to each other and.
Yeah, absolutely, and that's important, and that will never stop regardless of whose command structure it's under. You know, it's Rogers County, it's, you know, Broken Arrow's EM, you know, there's constant communication. And then, of course, there's shared resources. If you'll remember back in March, Beggs got hit. We are the big hub in northeastern Oklahoma. We sent folks down there to help with the rescue and recovery on that. And so those asks will always continue to come in as the, you know, the big entity on that. And that's what makes emergency management, you know, so niche and unique is, yeah, you really have to coordinate. It's a balance between looking out for your individual needs and also looking out for, you know, the regional and state as well.
Yeah, I know tornadoes don't acknowledge municipal boundaries, so that's good to, thank you, that's really helpful.
yeah.
Counselor Dr. Wright?
Thank you. We had talked before, and so I just want to amplify what the commissioner said. Our nearby municipalities are already doing this, which was new information for me. I think sometimes when we think about county, we think they're doing Broken Arrow, Lawson, all of them, but they've been independent. And so that was a little reassuring to me that like we weren't the outlier.
Right.
And 85% of Tulsa County's population's in our city, so I appreciate you, you know, we're the uninitiated just kind of responding. So I do want to amplify, this is a 61.6% increase in the fiscal 27 plan, you know, we've heard why. I think there's an error in the math on page 23, because in fiscal year 28, there's the added position of deputy directors coming in at 113, and then there's some $40,000. I'm just trying to understand how we add a $113,000 position, but we only add $40,000 from this fiscal to the plan year, so I
Is
don't.
it capital? Because we have that capital cost for our local Dominator 3.
I don't know, at the bottom of page 23, it says next year you're gonna add a deputy director for 113,000, so there'll be 4 people on staff.
Yeah.
Or is that just like at a certain
Yeah,
percent of the salary?
Christy's looking at it. If you can give
Okay.
Christy a minute.
Yeah, and then
She may have an answer.
some of it's capital.
Come on up, Christy, please.
Anyway, while you're looking at that, is there a reason that you don't wanna just add the deputy straight out? Is it just a financial reason, or?
Yeah, I think there was just a, you know, financial growth reason of, we know that there's still startup and,
So just for my colleagues, I think this will be closer to a $500,000 venture once we get fully staffed up, and that's just something to be mindful of. It sounds like we don't really, I mean, I'm just gonna say, it sounds like we really don't have an option if they just dissolved with the council.
Yeah, there's nothing else.
I feel like we're being told we get to vote on a thing, but it's already happened, like
Yeah, it's happened.
the train is pulled out of the station largely.
We don't have a choice.
Which is a little interesting, right? It was on the mayor signing agenda today that we
It's one of my questions.
can't
yeah.
stay in a county agreement as it was conceived. So I find that,
So it was done before the budget was approved.
I find that interesting, and, you know, we already have the senior administrative assistant on staff right now, so, those are things I have questions about, just how we find ourselves backed into a corner in this way. I'm not opposing or in disagreement that it's probably better for our city to take this on for ourselves, because of the accountability pieces that you talked about. The grants fiscal compliance assistant is a pretty low wage compared to the other ones, and I'm just wondering if that is conceived as just purely administrative, and the only reason I'm flagging it is, government grants have a lot of boxes to check, and I just know a few years ago, we had an incident where, as I understand it, things were not tracked properly, and we were not eligible for the FEMA reimbursements, and that negatively impacted some of our larger partners in the homelessness space. And they're still struggling to close that gap. I see Mr. Smith sitting behind Councilor Lakin. So it would be crucial that that grants compliance assistant really can manage all of that, and I just wonder, you know, it's like AT 28, and it's a $46,000 a year job, like, that's pretty entry level sounding. And when we're talking millions and millions of dollars on contract reimbursements, I wanna flag that, because I know that our nonprofit partners that step into those spaces, a lot of the times then get left holding the bag, and I just don't think we can continue to do that with them. And I'm guessing that the grants will be primarily through FEMA, maybe some state reimbursements, or matching grants or something.
So can I comment
Yeah,
on both of your points?
Yeah, of course.
So I want to go back to the timeline for everyone. The discussions with the county about moving forward started the day, I don't have the specific date, but the date of the former director's arrest.
Sure.
'Cause I was actually up there that afternoon, and he showed up on the 9th floor of the county building, because his access card hadn't even been turned off yet. So, those discussions started almost 10 or 11 months ago. Moving forward,
So but it wasn't just because of him not, like, him having a criminal issue, it wasn't like, that created.
that opened the door for the conversation.
Okay, cause I was like, obviously that's one major personnel problem, but, okay.
The
Right.
position's been replaced and rehired.
Right,
It opened the door about what are we gonna do moving forward.
right.
And so those conversations took place. I realize that what the perception is, that it's on the mayor's signing agenda today, so I wanna give some background. It is completely coincidental that it was on for today. It was not aligned or strategic or anything. Legal's involved. There are several iterations of contracts going back and forth. I will say that Jen and Christy, it was a tedious process going through the financials, as well as some of the IMT folks and some of the fire guys, and Bill going through literally the junk in the EOC that had been down there for 30-something years. And so it was not, it didn't go, our goal was to have this done by January 1st. It just didn't work out that way. The county commissioner signed this 2 weeks ago. We would have had it on the signing agenda last week. They forgot the front page when they signed it, so they had to re-sign it the following week. So I just wanted to be transparent and put that out there, that there's not any kind of plan in place to have it signed today before this presentation. So, and then, Counselor, to your points about the grants, we know we have to get that right. We understand that. We have felt the impact of getting that wrong. I worked with HR. We looked at kind of where that is in the workflow and classification system, and that's where it fell. I know that we have had several folks reach out about, hey, you're standing up an emergency management office. I'm interested. So I am confident that we're gonna find really good folks, and we know what's happening on the federal level with the shift with FEMA. There may be some folks looking for a job as well. So hopefully capitalize on that and get the best people in there that have the city's best interest.
Can you just clarify this, plan year is going up 40,000, or is it 113 plus 40, so 153?
So again, what's the salary?
Plan year's going up 117, so on that very top line, it's going from 306 to 423, and that's $117,000, and that is described down in the FY 28 changes as 4,000 for benefit and compensation adjustments and 113 for the deputy director.
Mm-hmm.
That 42 that I think you're referring to, that first line, Is it?
No, I was just looking from fiscal year 28 changes for operation at the bottom of the page. And then on the next page, the other, is that all contiguous? Okay, 1, 2, 3, this all goes together and ends up at a 40?
Yeah, so that's.
Okay, that's hard to extrapolate from a page turn, but now I've got it.
Yeah.
It looks like this was a total and that there was another total. So even with adding the new position and the other computer and all that stuff, it's just a $40,000 increase.
And that's because of the capital, this, in FY '27, we're purchasing the
one-time,
vehicle.
yeah.
And so then next year, it's not there, so that's the
Oh,
negative
okay.
83.
Yes.
It's not really,
Is that, so these one-time expenses that we're realizing this year will then become an ongoing expense in a staffing position of 113?
113 will be ongoing.
Yeah. Okay, so I retract my $500,000, it's 465, at least for,
Give or take 43. Okay, are you done?
guessing the deputy might want a vehicle too. No, I'm just kidding, yes, I'm done.
Counselor Lakin?
So some of my questions have already been asked or stated in a different way. I'm just still a little bit, I don't know, concerned about the actions. We tour cities where we intentionally tour cities where city and county governments have merged, and now we're unmerging. Not just this, but the 911 center. So this is at least the second time we've done it. Sheriff's office does 911 versus being, right?
That's been years though, that's a few years
I know,
back.
yeah, but still, I mean, the chamber intentionally takes us to places where city and county governments are cooperating rather than acting independently. So I don't know if I can properly assess, like, so for $150,000 extra, what's our return on investment? So we're spending $150,000, what are we getting for that extra $150,000, if you will? I
Yeah.
know independence is one of them, I've heard that.
Yeah, it's in the accountability and really just being able to be more strategically focused on what the city of Tulsa needs are, making the city of Tulsa our priority. I will say that the city and county, Tama, was an outlier. It was in the vast minority in Oklahoma. Oklahoma City does it, and I'm
What do you mean, so what is?
Oklahoma City has a city emergency manager and an Oklahoma County emergency manager.
Yeah,
Norman,
but-
Oklahoma, or Broken Arrow, Owasso, you know, so we were, probably the only that still have a city-county, emergency management system. And I could speculate that we would be paying more into TAMA in this budget year, simply because we would be replacing a director, and the price of the director is a little bit, I mean, to be marketable, right? We want somebody with certifications, we want somebody that meets the standards, and there's a market demand for that. And so I can't anticipate what growth would have been asked if we were still at TAMA, so I'm not sure it's a full $162,000.
What was he making when he was at?
I believe he was in 91,
Yeah, and what was posted wasn't super
Okay.
high either.
which is well below market for
Yeah, I don't
emergency
know.
managers.
Yeah, so we could have been going up 70,000 or so compared to 150 in this case. And then I'll just have to continue to dig. I am concerned whenever we do have to make these decisions, like, what if we just, as a council, said, no, we're not gonna appropriate any money toward this?
That was gonna be my next question.
I mean, it's a
Seems like we don't have
possibility,
that
like, if we
option.
don't like this decision that's been made, but we don't have that luxury, we have to do it. So it's a catch-22 position, probably, unless there are things that I can't think of at this table that would cause it. We wouldn't do that, but we're also caused to do something that could potentially be less efficient. I'm not saying that because I haven't really studied it, that's why you're here, and we're just discussing it. Help me think through, like, I don't know if you were involved in the EOC whenever we were sitting down there in 2019 watching the, waters rise to nearly 300,000 cubic feet per second. But there's everybody crammed into a very small room. County officials, fire officials, sheriffs, senators, PSO, ONG, you name it. Okay, so what happens now? 2019 happens again. Where are we? Are we in two different places? Our fire and police for the city of Tulsa sitting in one facility, and sheriffs and,
No, we still have a joint command in one location.
okay,
So the sheriffs, the county does plan to stand up their own EOC for county operations. We will operate out of our EOC as the joint command until we get a brand new one at the Public Safety Center. And then we'll all
Okay.
fit in there much better.
okay. So if some big regional disaster happens, they all come to our place. So we're not trying to staff two different centers at the same time. Costs should not go up for us in that scenario because we have to be two
Correct.
places at the
Right,
same time.
right.
Okay, and neither does PSO or ONG or, okay, those other entities.
The
Okay.
coordinated response is what's the important part. And having everybody in the same room for the same communications and the same planning and strategy is what makes that successful. So that
Yeah.
is important.
Yeah, good. Okay, I think that was my major concern. I can't get my head around the return on investment yet, but it's not because of the way you've answered the questions. I'm trying to assimilate your information into what I'm thinking about this, given that, we all are focused, regardless of our background, we're all focused on saving money and using money most efficiently. So just need to figure out how this is more efficient. Well, how this is more efficient or the outcomes are better, or both, for
Sure, I appreciate
our
that.
city and county.
Yep. Thank
Okay.
you.
Okay. That's all we have, Commissioner.
Okay. Thank you.
Thank you.
Thank you for your time today.
We appreciate you being here. Okay, number 4, discussion with Healthy Minds Policy Initiative and partners on city budget considerations for addressing treatment needs of Tulsa adults experiencing homelessness with serious mental illness. I requested this agenda item because I know that we keep asking about different monies and different pots going to different things, and we just need a better understanding of what we've funded, what we haven't funded, what we might need to fund in this arena. And so had a meeting with Zach Stoikoff, and after talking with him and seeing his presentation, I thought it was very worthwhile sharing with you all so that we can ask questions. So with that, I welcome Zach to the table. And
Yeah, thank you, Counselor. Zach Stoikoff, President and CEO of Healthy Minds Policy Initiative. It's so good to see you all twice in one day. We had the big press conference earlier to announce some work that we've done to improve crisis response with mental health and public safety in Tulsa. I've got my colleague Mark Smith from Housing Solutions here, who has some expertise in the homelessness service side of things that I thought might be valuable for this conversation. So what I'd like to do today, as the counselor said, is walk through with you some research that my organization, Housing Solutions and others, have been doing to really look at what is it that Tulsa needs to really address this problem of the confluence of mental health and homelessness, right? So if you've got somebody who has a serious mental health issue and they are experiencing homelessness, what does a system look like for that person? And I think what we've done in the past is we've really looked at the homelessness continuum and what kind of housing and things like that we need. And we've looked at the mental health continuum and what all of our residents need in terms of mental health care. What we wanted to do, and I think what is unique about what I'm going to present to you today, is we wanted to look at where these two systems sort of coalesce and intersect. And what does it look like for them to be highly coordinated and really addressing this challenge? I know that I serve on a Way Home for Tulsa, the coordinating committee for federal funds for homelessness services and housing in Tulsa. And I know from that work that we're housing more people than ever, but I also know that we're seeing folks who have mental health challenges. And this is, we all understand, a relatively small percentage of those who are experiencing homelessness. However, we all want to solve that problem. We want to get folks help who need help, and we can't have these conversations in silos or in discrete buckets, right? If we're talking about those folks who have these two needs combined, we've got to talk about how the system needs to be combined to kind of, to work on that. I want to walk through just briefly, if I could, do they have this? Sarah's going to pass this out.
It's up there.
So this is what you all heard earlier today, because it's really the foundation of what we're going to talk about, is what we've done in Tulsa to really work on folks who have mental health emergencies. How do we deliver the right support at the right time? To people who call 911 and we need COPES or whoever to go out and respond, how are we creating a coordinated system here? Because I think it's relevant that we look at that level of coordination for the entire system. And we've got some things to celebrate today. Today we announced that Tulsa has effectively seen a 54% decrease in police going out on mental health, primarily mental health calls. When someone calls 911 center with primarily a mental health issue, they need police, 54% reduction. And it's not that we're delivering no help, we're delivering the right kind of help in those situations. We're getting a mental health clinician on the phone who's embedded at the 911 center. We're sending out an alternative response team, or just mental health folks, clinicians, to go respond to those needs. And essentially diverting away from traditional first responders to the tune of 89%. So 89% of the time, if you call 911 center with a mental health need, our system and protocols say you don't actually need police and fire. You need a mental health clinician. And the city is saving, by a conservative estimate, $500,000. $500,000 on that. I think $400,000 on the year. And that's conservative because we don't even know or calculate the impact on, legal costs and things like that associated with taking a mental health centric approach. Why is this important? This is where I'm going to start. As we go through this chart here, what you're looking at on the screen is really a visualization of what is a combined and coordinated system for folks who have serious mental illness and homelessness. What does that need to look like? We would expect virtually every community in America to have services aligned with each of these buckets. We would expect the appropriate level of services in each individual bubble that you see here. Now there's multiple services associated with each bubble, so there might be 3 or 4 different things that we're doing under each category, but we want that category to exist appropriately. So what Healthy Minds and our partners did was look at, does that essentially exist in Tulsa? And where are those glaring gaps? Because frankly, in any of these horizontal streams that you see on this screen, you can sort of take an education analogy here. First grade, second grade, third grade, but if there's a 4th grade gap, and we don't have 4th grade, then a lot of students are going to go through 3rd grade and not be able to succeed in 5th grade, right, because they didn't have 4th grade. And what's going to happen is, in the case of homelessness and mental health, you're going to have people fall through that gap and go straight back to 1st grade. And that's what's happening is the waiting room of the street, when we don't have something that can catch them along this pathway to stability, they are going back to the waiting room of the street. What we are saying is that we need all of this at one time. And I hate to say that because we all want a silver bullet and we all want to know what the one program is that we need in Tulsa. There's not. It needs to be a coordinated system and we need all of it at the same time to really be working. I'm going to walk through a little bit more detail on this, and I'll ask Mark to talk more about the housing and homeless supports line of this. But what you're seeing here is essentially on the left side of the screen, these are the systems that are designed to catch you in your most unstable element, right? You have an acute need. You have a mental health challenge, suicidality, significant drug issues, you are a danger to self or others. And then we ultimately want to get you over to the right side of the screen, which is the services that you need to be a little bit more stable long term, and then ultimately off the screen entirely, so that you're stable and secure in the situation that you have. So what we would expect to see is an evidence-based mental health crisis system. We heard about that in the press conference today. You need someone to call, someone to respond who's a clinical support, and a safe place to go for short-term mental health stabilization, medications, 1 to 3 to up to 5 day stay. That's what a crisis system is, right? Those 3 components. And we learned that there's some things that are working in Tulsa in this side of the spectrum right now. When you go a little bit further down this is where we start to fall off, and you'll see in a moment we've got a chart that shows you where we're falling off. But what happens when you get released from a crisis center, right? That 3 to 5 day stay? Are you discharged back to homelessness? Or are you maintaining your treatment beyond that? We would expect to see a respite crisis center. We would expect to see services that can go to you wherever you are, home, community, neighborhood, And we would expect ongoing outpatient services, largely at a certified community behavioral health clinic, but other kinds of providers too. And as we know, those are, in Tulsa, we've got Family and Children's, Cree Oaks Counseling and Recovery Services, and Grand, those are RCCBHCs. Those services need to be deployed effectively, right? So if you'll bear with me as I just walk through briefly what each of these things mean, and then we'll get to kind of where the gaps are. I'm going to pitch it to Mark right now to go through housing services and supports and generally what this continuum needs to look like.
Yeah, so in a similar way, from the homeless response housing services system, if we look at that individual experience crisis, right, they might just need some day supports to help figure out what next, or they may need shelter as a place to sleep, recover stability. And you see as an individual has more progressive, challenging situations in order to get back into housing and be sustainable, there needs to be a more progressive sort of housing resource. So again, as Zach kind of mentioned, you're expecting most folks, there's going to be a progressive drop-off. We're going to meet their needs early. They won't need more significant care, but certainly we all know there's individuals with significant care. And so that can go from shelter access to more of a transitional space in some stance. That can be in a facility, or that can be sort of like a short-term supportive intervention. Sometimes, just getting someone reconnected, there's not an instantaneous, but if we can give them 2 or 3 month time frame, that'll give a person a chance to maybe get reemployed, recover from whatever traumatic incident might happen, and then they'll be supported from there. And then for other individuals, it can look like more of a long-term housing need. These folks are going to need more time and support for stability and recovery. Rapid rehousing is typically something in the 1 to 2 year time frame. Affordable housing, right? These are folks who are going to struggle to just pay what the market can bring us in terms of units currently. So we need to find something that they're going to be able to afford on their income. And supportive housing can be permanent supportive housing. So that's a homeless response system term for individuals who are both chronically homeless and have a documented disability. So they're going to have likely need some more long-term supportive care. Supportive housing could also be for some individuals, like the end result of the homeless response system could be assisted living. It could be nursing care. Like that's really, so it's going to be more of like their individual independence is going to be really, really challenging long-term, and having that right intervention. In a lot of communities, what we see is that permanent supportive housing is really tightly paired with the mental health, with the substance use services, because there's a housing component, but there's also that healthcare well-being care, and those are really tightly coordinated. Sometimes it's all in one, oftentimes it's a partnership. And I think one thing that isn't always here is that sometimes the permanent supportive housing is actually the long-term care when an individual has transitioned through the mental health and substance abuse. So once we've gotten to them to a point of stability, we'll need some long-term support to ensure that they don't fall back into crisis. But you have that inventory of housing there for those individuals.
Thank you, Mark. This third in the middle here is really, I think, an important area to talk about, because it's not strictly just the treatment system, it's not strictly just the housing and homelessness system, right? We feel, and we've talked with experts ranging from Clutch to other communities who have been looking at this and doing this kind of system work, that you do need this element of mobile outreach and engagement that looks like a similar spectrum of intensity, from light touch to we're trying to connect you to the early interventions and the services like we do on the outreach side, all the way to we want to get you employment skills and get you connected to jobs. And we see a lot of gaps typically in communities in this space, and I'll talk about that in a minute, but really this is the transition between the two. These services often float with you wherever you are, whether you're in transitional living all the way into affordable housing, or whether you're in a crisis system, you're getting connected to long-term care. Because we really do want to see both the horizontal kind of flow appropriately, that you're getting transition between, to the next level, next grade, so to speak. We also want to see the vertical flow. So that if you're in day supports, you're connected to the crisis system. I mean, that's a rough way to look at it, but there's this sort of connection between the housing side and the treatment side that needs to be there. And often this is how we do that. Zooming out a little bit, actually, on that front, the complicating factor is we could actually, and I didn't say this before, and I'll tell you that I lied to you, we could have every single one of these bubbles at capacity and strong, and still not be solving the problem. If they're not coordinated, if people are falling in the cracks between the referrals, if they're trying to go from one level to another and they kind of fall through, that's where a lot of the problems happen. And if you're not coordinated with the criminal justice and legal system, because that is both an entry point and frankly a way for some individuals to get access to care and services. So what you're seeing added to this chart at the top is a reflection of really three components of a coordinated system that we need to see in Tulsa and in every community. We need to see somebody who's looking out for their safe transitions between levels of care. Is there a recognition that each of these bubbles is operated by a totally different kind of provider in many cases, and are they sharing their collaborative data sharing agreements so that we can talk about this, which is hard to talk about individual clients when there's private health information involved, right, with HIPAA. We've got to look at that. And that these organizations are actually coordinated. And what do I mean by that? What I mean by that is it's nobody's job to look at this, what we're looking at right now, and say, is this healthy in my community? It's been nobody's job to look at homelessness services, housing, mental health, and outreach, and all of it together, and is this working well? The providers and the community partners and players involved really need to have a place to coordinate and look at that, look at the health of that. Like we do on the crisis side, when police, fire, EMSA, mental health, they get together at the First Responder Advisory Council and they look at the crisis system and they say, is it healthy? And are we transitioning people appropriately? Are we looking at the data? That needs to happen as well. Emergency detention on the bottom, court-ordered outpatient alternative courts are ways that the criminal legal system interacts with this housing and treatment system. As you know, a police officer or a licensed mental health professional can order someone into compelled treatment if they are a danger to themselves or others. At times, that is appropriate. A civil court can be petitioned by family, for example, and order you into court-ordered patient, and there's specific services that we have to do this. That can be a tool. And then alternative courts for individuals who have felony convictions, who may have an opportunity to reduce that felony charge if they go through treatment, and there's sort of a carrot and a stick approach. All of that is an appropriate and healthy part of a functioning system, and that needs to be coordinated as well. Moving into what we feel like we need in Tulsa, and really the point I think of this conversation is to sort of look at, and we wanted you all to have not only an understanding of the framework of what a community ought to have, but in Tulsa, a relative idea of where the gaps and strengths are. Because we've got some good things going on and some gaps. And just to go here, so what you're seeing is a color coding indicating that those outlined in blue generally are strong. They're not perfect, and in fact, in every blue box here, I could tell you about scale and quality issues that we need to improve. But compared to the others, it's a relative strength. Okay, yellow box would be it is partially existing in Tulsa, that service, or it is just a relatively extreme need in terms of scale or quality. And then red is it is not here at all. And this is a major gap where people are going to certainly fall through and go back to that street waiting room. So starting at the crisis side, there could be an argument to be made here that we're not entirely blue. And the reason I'll say that is because although the last year we've worked hard to divert 54% of police calls, we're getting more people mental health care, but the reality is that there's still a chunk of the 911 calls that come in that are not benefiting from the mental health diversion program that we've set up. And that is not anybody's fault, and that is a challenge that we're working through right now. And what I mean by that is that if you call and you say, police, fire, medical, I want police, you get the benefit of this wonderful 911 housed clinical support. If you say medical, you go to the EMSA call center. Mm-hmm. It doesn't interact with the diversion program that I just described. So by policy, EMSA is going to send police out most of the time to a mental health call. They're going to send an ambulance out virtually 100% of the time. On the other side, we only need to send police out 89% of the time, right? And again, that's not at all a criticism of EMSA, who's at the table and very actively working on this problem, earnestly actually with us right now. And I think they're actually at the First Responder Advisory Council meeting happening currently. So this is an active area of work that I think they're very supportive of. But the reason I bring this up is because if about 40% of the 911 call volume intersecting mental health is going to EMSA, and we figure out a way to get the mental health side plugged into that, which we think we will, we're going to see about a 40% increase in demand on our mental health provider, which is Family and Children's Services, which operates the COPES program. That is not possible under the current state funding environment. So if we want to not just solve 60% of the need, we want to solve 100% of the need, Family and Children's has provided a budget for how we would potentially staff up to do that. They would need to add a mobile response team. They would need to add additional staff at 911 Center. We would be looking at a need of about $800 to $1 million. Annually to staff up to do that, to again get us from 60 to 100% of the need. I have that budget if anybody's interested in that, and happy to pass it out.
Yes, please.
And so what you're saying is, someone dials 911, for them to access codes, which we finished celebrating, we're all celebrating, they would need to request police or fire. But if they if they request paramedics, then they wouldn't have access to the COPES resource.
There's a couple of ways that happens. You may answer police right away, say, I don't know, mental health, maybe
Right.
police, and then you'll immediately get, through this model. If you immediately say medical, then they're gonna shift you to ENSO. They don't wanna waste a second
Right.
of possible time when the
Obviously,
ambulance
yeah.
needs to be there. There's a good reason for that. Now, if in the course of this early conversation, the call taker at the 911 center does identify it as mental health, they're gonna put it through the mental health
They
triage
can
protocol.
transfer you back.
Yeah.
Okay.
It's just if you immediately say medical, and that's the piece we're gonna work out, EMSA is a great partner in that, but when we do, again, we would have no ability to staff up to meet that extra 40% currently today.
Okay.
And I think it's important to realize that Family and Children's is essentially providing this core city service for no charge to the city, just out of their own funding, and it's saving us money, right, and we should look at that.
Hang on, are you done with your presentation?
I've got more to go through, but if there's
Let-
questions
I
on
just have
this,
one
or I
budget
can,
question.
I do, it's
related to
about
that.
this slide.
It just,
What?
I can finish going through the slide, or happy to take
Let's
questions
go
on
through,
that.
finish your slide, and then we'll come back, I got you.
Okay. And then if I could just briefly, Counselor Bellis, if you were gonna ask about what I just handed out, just so the council knows, this left-hand column that's titled TPD, what they mean by that, this is a bad,
Is that what
we
this
need to rename
is?
this. What they mean is that's the current police-centric mental health diversion system that they are currently funding out of their own budget. Medical would be, if you say medical at the 911 center, that's the piece that we don't currently have funded, if that makes
EMSA
sense.
side.
Yeah, and then there's the additional mobile response, just so you know what you're looking at. And then going back to this chart. So on the treatment side, our biggest gap here where we have nothing at all is what we would call behavioral health medical respite. This is an evidence-based model where if somebody who particularly is experiencing homelessness comes out of our crisis system or is discharged by an emergency room, where do we send them? Do they need a longer length of stay somewhere? And usually the answer is yes, because 3 to 5 days is not enough to straighten out many years of mental health challenges. And 30 days is not enough, but 30 days is often enough time to start the family reunification process, to get somebody sober and to start thinking about long-term solutions for their life. And it can be transformational in that 30 days where the treatment folks and the case managers really know where somebody is. We actually just took some folks out to a model in Denver that does this. They have a crisis center, and then the second floor is a respite center where people just get discharged to the second floor. And they're there for 30 days, and they're working on housing for them during that 30 days, but they're working on treatment too at the same time. They're trying to get them ready to take that housing, right? So I think that's an important model. We just don't have it at all. And Mark, I don't know if you can comment on
Yeah, I
the
think
effects
that-
of that.
I think that's one of the challenges, where you would say high utilizers, and there's been a lot of work on high utilizers of these individuals who are going frequently into crisis care or sometimes even into the jail, right? Because that crisis can result in justice involvement, and then you're seeing a re-release, and so those individuals are kind of cycling back into the street, or they may be cycling into a shelter, and then there's a crisis happening. Because the acuity of need, right, somebody can, if we go into a sobering center or a crisis facility, they may achieve sobriety in a short period. But if you're, especially if you're dealing, and I'm looking at Zach here, with a co-occurring mental health condition, right, there just needs to be time for that treatment to start to take effect, and then what can happen next. And so I think you hear this from homeless response service providers. They're talking about individuals that are like really, really high acute needs that like we're not equipped to serve their needs, like, right? And you've seen different aspects of it. We tried hotels, or we tried other types of transitional space, but that part of having like the intensive treatment portion of that is a pretty significant gap. As Zach mentioned, for many of those folks, that can be a reconnection of family and then ongoing care. It might be now that the person is at a level of stability, the other interventions in a homeless response system can meet their need. But if we can't get some of these like really acute issues up to a baseline, then this is where we continue to kind of see the cycle.
Yeah, thank you, Mark. And moving along here, we have a relative lack of these intensive services that can meet you in your home and community. We've got some of them, largely at the CCBHCs. Moving down to the middle row, we've got street outreach teams, okay? I'm not saying they're deployed everywhere they need to be all the time, but relative strength compared to the others. Intensive case management and assertive community treatment are two I really want to focus on here. So what we need are something that looks like a mobile team that's able to provide wraparound supports for people, everything from medical to mental health to social services, to job connections, all of these things sort of combined. And many times communities don't have this. We have the outreach teams that don't provide long-term case management in that way necessarily. They can connect you with other folks who can provide pieces of it, but a team that can really be with you through this process of getting stable and connected to housing and treatment, right? And be with you ongoing. Intensive case management would be a term to cover anything that is that level of case management with those other supports surrounding somebody who isn't necessarily very seriously mentally ill. It could help those individuals, but if you are very seriously mentally ill, you need something called an assertive community treatment team. This is a decades-long approach that has been well studied. It is nothing innovative or new. It is a tried and true approach that is a mobile hospital room that goes and meets you where you are, that is available 24/7. That if we're doing the model right is providing all the stuff I just said in terms of case management, but also psychiatric support and medication, all those things that somebody needs to be stable. We have and don't have this in Tulsa. We have lots of ACT teams. We're continually working on ensuring that those teams are hitting the mark. But what we don't have are what we call forensic ACT teams. And this is a big need that we've identified in Tulsa, because for those individuals who are both in this category, they've got serious mental illness, potentially homeless, those who are in and out of the justice system, interacting with police a lot because of a variety of reasons, there may be a violence risk in a small subset, right? There needs to be a level of intensity here around the forensic and criminal justice side. We don't have this at all. And I will tell you that this is for those who work in the criminal justice system in Tulsa who know about this model, they say this is our #1 wish list item, is a forensic ACT team. Our data indicate we ultimately need 2 in Tulsa. But these teams are difficult because they're expensive. They're not as expensive as continuing to jail and house people in the ER, but they're expensive. And they have relatively small caseloads because you have to in order to provide that level of intensity for those individuals. But this is the team when we're looking at somebody who is shouting at the street or making people feel kind of unsafe. There's a serious mental illness there and they are homeless. This is that level of care that we are missing for that individual. This is what we need. And we do have a willing partner in Family and Children's Services that Healthy Minds has partnered with to develop a proposal to launch a forensic ACT team in Tulsa with some of the best national consultants to ensure we get it right in Tulsa. This is something that we've been working on for a number of months, frankly, and telling everybody in town that we've got the model for this. It's ready to go.
Is this in this budget?
No, that's
Okay, just
separate.
checking. Okay, just checking.
The forensic ACT team, again, saves about 50% of the costs on the hospitalization and jail side and the interaction with law enforcement that gets reduced because we're actually meeting the needs of these individuals. So I wanted to highlight that as a proposal that has been made to some private funders. There is some interest in that. It's not fully funded, there's not commitment, but there's interest. If the city were to come in at a small amount to entice private funders, I think we could get it done ultimately. And then moving down to housing and homeless supports, we are about to have a low barrier overnight shelter. Mark, would you like to kind of talk through just briefly and I think this is a lot of where Safe Move is filling in some gaps too.
Yeah, and so you can really look at Safe Move in terms of the long-term housing support there. I mean, that's been a huge gap in our community, and there's been this first investment, and I think you've seen in terms of what we need in a sustainable investment there of how to be able to provide enough housing for every individual so they can move off the street. So those are the areas I think we've talked about quite a bit with Safe Move about how we move those individuals off the street into housing, what that level of investment will look like. And I think that, over time in getting to that level of investment and seeing the result, we can get some of that long-term housing, certainly on the rapid rehousing into Blue, certainly what the city has been working on for quite a bit in terms of our affordable housing need. That is another area where through, I want to say Impact Tulsa, that's not the investment, $75 million into Improve Our Tulsa. It started with an I. Improve Our Tulsa and addressing the affordable housing stock, that's another area that we're working to get to Blue. And so it helps both areas. I think with Safe Move Tulsa, I can talk about just a little bit of this overlap. So as we've worked and encampments, right, when we think about those areas. The individuals that we're working with, we're having a 90% success rate of the individuals who are there, who are working with outreach, who are moving into housing, and certainly there's co-occurring mental health and substance use issues. But those are individuals who are out of state, right, where they can engage with us, and they're in a regular place, like Safe Room Tulsa is looking at geographic location. What Zach is describing is those individuals who, because of their severity of needs, we can go and try to have a conversation, right, and it's not, and they are people who are constantly physically moving, but also physically cycling through these systems, and so that's, again, a small percentage of the population, but the acuity of their needs, the acuity of the impact to the community on their needs not being met is pretty significant. So as you think about like where we're at blue, where we're at yellow, where we're working towards blue in this collaborative aspect, this is I think one of the, we're talking about, it shows the progress of the investment that's been made over the years. Like we're addressing the local shelter need, which will be really critical. How much folks can we avoid needing to move further down this if we can catch them in shelter and create resolution really quick. And for the folks that we have who are long-term homeless through the investments in Safe Room right now, getting them into housing stabilized, making that fast so they can start to recover from that trauma. This last piece of the really acute mental health, substance abuse issues, criminal involvement, having that level of the right level of care so we can get some resolution there. I think that paired with, again, behavioral medical respite, like we're gonna have to get to a point where the earlier interventions can sometimes prevent the need for the more significant. We'll always have to have that, but we have to do both, right? We have to invest in the early intervention, and we have to work with some of the really high needs and co-occurring between homelessness and mental health issues that we're dealing with currently.
Very last thing is this top bar that's mostly red, and I will shout out to Dr. Gibran Pasha and the Mayor's Health Initiative, because the collaborative effort that's kind of gone around behavioral health through that work has identified that top area as their #1 priority, is to figure out this data, coordination, levels of care transition, and make Tulsa a leader in that. I think that's a lofty goal. It's gonna take some time, and we don't know how to do it yet. We're really early in the process of that. But just to point out that that is an emerging priority coming out of that work.
Can I have one extra point here? Sorry,
Sure.
just, and I'll be very brief. One thing that Zach and I didn't mention is that Healthy Minds and Housing Solutions have been working with the CCBHCs and the permanent supportive housing providers. So these individuals who are chronically homeless, struggling with disability. So we've been working with these providers for over a year now on addressing some of these data challenges, where many people who are going into homelessness are actually connected to a CCBHC for services, but because of HIPAA or the volume, that coordination of care has not always been delivered really well. And so where we're at now is that every individual that is moving into permanent supportive housing, through the partnership, we're identifying if they already are eligible and are working with a CCBHC. If they're not, we're getting them connected to that because we know it's really critical. And now there's actually coordination on the actual wraparound services that is happening. We found a way to, there's a lot of technical aspects about how we can share information, but that's been a significant amount of progress. And that's something that is coming at no cost to the city. That's leveraging existing Medicaid resources, which is really important. So
And that's why that's yellow.
That's why that's yellow, because of the year's worth of work on that.
Okay, ready for questions?
Absolutely.
I know we're running short on time here, so I'm going to try to be brief with mine. #1, I'm going to go first, and then Councilor Dunn. You talked about the red up there, the and somebody doing, like we're here, there with things. I guess my question is, are there any cities that have this type of model where they have one person that's kind of coordinating everything as they go through the bubbles? And who is that, and are they doing it well?
We are looking into that right now. We think there's a model out of Dallas we can look at, and there's a community in Illinois that we're exploring as well, but I don't have a great answer for you yet, because we're researching that.
Great. And would you report back when you do find that out? Thank you. Up.
Thank you. I have a lot of questions, as you guys can imagine. I'm going to try to condense. I'm questioning, I'm just going to throw some points out, and then if you need further explanation, I'd be glad to email. So I was thinking of the crisis centers, of which we have very few, if not but 2 maybe. And short-term beds, I'd like a number on the short-term beds that we're looking at for the crisis centers. I'm also looking at, as I mentioned earlier, Clubhouse International Crossroads is closing in Tulsa. They were instrumental for helping people with mental illness create community plus look for jobs. And so we're going to have an entire population that had a community that's going to now be displaced. That's closing at the end of the month. And of course, more details on a low barrier overnight shelter. What are we looking at as far as like number of respite beds? I know it's a lot of questions, but these are just things that popped up as I was listening, as well as partnerships for employment. Do we have partnerships that we're already talking to? Yeah, okay, and I'd really love more of that information. And then I'll just close it, my questions, because we are short on time. So the FACT team, I know that the PAC teams actually took a hit this year due to funding. And they also converted from a method of stability to levels, which includes stability and medication. And so this FACT team that we're looking at, what does the team consist of? What are the professionals that would be involved in that? Would it be case management, a nurse, a psychiatrist? What are we looking at?
Yes, those three, there's typically a peer or a social worker as well, and then a probation parole officer
Okay,
typically is involved. Psychiatry consults.
okay.
Yeah.
Okay, and then how many teams are we looking at in this request?
The proposal is for one, but we ultimately need two in Tulsa, we think.
Right, and so one team would consist of, say, 5 professionals that would,
No, more than that, I believe, but I'll have to get back to you on the specific number.
okay. And would the court system be involved in that as well?
Yes,
Okay.
100% on a forensic act.
Okay, and then would it also incorporate levels like the PAC team where you're utilizing, say, level 1 for, 3 months, 6 months, and then you move up to level 2 or 3 or 4, whatever? I'm just wondering about the time.
Yeah. I'll have to look more into the levels. I think we get in a trap sometimes of putting people on act
Right.
teams too long.
Right.
And what we need to do is make sure that we're graduating people off further into stability.
Mhm.
And so it's one of the things that we would look at with the technical assistance provided by the national consultants we've identified, is making sure that's happening.
What's the time frame that would be the minimal?
Once the funding is identified, we can get one launched in a matter of months,
Yeah, okay, so we're looking at 6 months maybe.
potentially.
Okay. And then I know that there probably are specific conditions that would put somebody underneath the FACT team. Can you elaborate on that, or would it be better to do that via email?
Well, I could just tell you briefly, serious mental illness, and you could add homelessness as a criteria, not necessarily. Serious mental illness is a criteria for the model, as well as repeated interaction with the criminal justice system and/or repeated inpatient hospitalization.
Okay, so repeated felony, misdemeanor, both of those? Are we talking like over a year, 6-month times? Yeah.
I think it's lifetime, I believe.
Lifetime?
It's designed for individuals who clearly they've had a documented
Recidivism.
history of, we haven't been able to solve this problem for this
Okay.
individual with the traditional systems.
Okay. I will hold the rest of my questions to email, but thank you so
Yeah.
much for the presentation.
Councilor Pellis.
Which I think that's exciting about, like, and I know it's not always fun, but like the need for the FACT teams to go, hey, let's get some private funding, at least per your point, like get one team going, see the outcomes, and then look at scaling. I'm curious, going back to what it would take to scale the this kind of COPE's integration to more, like, right, the more medical facing proposal here. Just a quick clarifying question when you mentioned, so this is like the full cost of the program just to family children's for the team, okay, for the current model versus if we went full medical, okay. And when you talk about this budget and if we were gonna scale it, what it would look like for the city to come alongside that, it is, can you say the dollar amount, like, again, that you, like, would say like this, like you, or you would say it, to provide stability that would be coming from the city for this?
Yes. you all are the policymakers on this, of
Yeah.
course, but what I would say as a third party, just Tulsan,
Yeah.
is that we have a provider who is providing a service that directly benefits the city and our city services, including stretching the manpower of our first responders.
Yeah.
And so I think it's a fair conversation, at least.
So just to clarify though, is this the cost, just to make sure I'm reading this right, the TPD side, that's what we have, that's what they're covering right
Yes.
now? Okay, so the delta for it to be scaled to go full medical,
Would be really the last two columns on the right.
okay.
Yeah.
So it's the $245,000 number,
Plus the 800.
Plus the age,
Yeah.
25.
plus the 825?
Yeah.
Okay, but,
Also a million.
And what we would do
Right.
is, I want to stress too, because I confirmed
so
this
this
with
is all
FCS.
just scaling cost right
Yeah,
now
it- and it is an estimate, so if there was a real if we want a serious number, we'll get a serious
Is-
number, this is an estimate.
Is the TPD, sorry, just to make sure I'm understanding, so the TPD column is if we were to scale the current model, and then the medical ones if we scaled fully to a medical one?
Yeah, so the TPD is what Family and Children's is currently paying to
Okay.
do this. And then the other two columns are if we were to take on the medical side of it and then add the appropriate mental health level response.
Okay, wait, when you say take on the medical side, that's in addition, like the TPD
In
side
addition to,
stays, and
yeah.
then in addition, okay, I went to.
Thank you.
Yeah, I think this would be
It's a
helpful to.
little confusing, I apologize.
Yeah, no, it's okay. I think it would be helpful to have laid out more. And then one of my thoughts also, or my curiosity would be acknowledging, like, kind of, you know, the journey we've even been on when you talk about ART and CRT, and it's been iterative and scaling over time. If there's like if you guys have recommendations about if we were gonna do part of this over the course of like a year or two, and then be able to scale in pieces, just being realistic about, you know, the nature of everyone's budgets. 'Cause,
Absolutely.
yeah, I think that would be really helpful to see kind of a, hey, if we could try to scale up and meet this need by this year, here's a gradation of ways we could approach that that's bite-sized. I think that could be really helpful if you could kind of maybe lay that out as well, just so we can think about, okay, optimally, to really try to meet a need or scale and build on what we have going, just in the next year, if we could just assemble this or maybe add one more, you know, like clinical social worker, let's try to do that, and then in year two, it would be great to scale to this. I just trying to think through those capacity things. It would just be so helpful if you all kind of had a proposal around that.
Yeah, I think that could certainly be done. I think to some extent you could also start with what's possible within the city budget, right?
Yeah.
We wouldn't want to pull money from anything else impacting this continuum because that would be robbing Peter to pay Paul, but what we
Of
want to do
course.
is if there was
Yeah.
100, 200 or something, we could look at what that could get us and then develop a plan appropriate to a multi-year scaling.
Or one of my thoughts is, and Mark, maybe this fits in with some of the recommendations that have come from like you all and Clutch, things like that, where, you know, if we're having these more upstream interventions really start coming into play and getting less into triage mode, and that's starting to offset those downstream costs, that we could like then, like if there's a point where it's like, hey, if we've done some of these like very urgent interventions, which I know this is still like a downstream intervention ultimately, but if we've done that and then it frees up some of the dollars we're spending after X amount of time, we're like, hey, we're not in a place where we're closing as many encampments or this or that. I'm just curious if there's a way to then know that hey, by this year we'd be able to offset the dollars over towards this one, which I don't know that this is the right thing to, you know, since this is emergency response, it's probably not the right thing to like delay scaling, but I'm in trying to think about what year the different interventions come online or we scale up, or when one need or dollar amount might sunset, and then we'd want to reallocate those dollars within still the same bucket of kind of, right, housing, homelessness, mental health, just trying to think about what that flow is on a broader scale, if that makes sense.
Absolutely, yeah,
Yeah.
I think it's a little hard to predict,
Of course,
I don't
we'll
want
make an
like,
algorithm,
Yeah,
sure.
or make a
Yeah.
promise
No,
about some future
we'll have
conditions.
Brock do it.
I do think that there's something we said, so currently, just speaking from the homeless
Yeah.
response system, and this is why I kind of mentioned, like, you need to have a really effective crisis on all sides, crisis and early entry point, and then what we need to do right now, because we have so many people who have, like, not had their needs met, whether it's substance use and mental health, whether it's homelessness, whether it's co-occurring, is that we really do have to address it at both ends, and this low barrier shelter, right, helping to mitigate long-term harm and trauma, and then what we're doing with Safe Move, what's happening with permanent supportive housing within the Way Home for Tulsa system is also meeting some of those acute needs. If we can start to see that shift of really, we don't have people who are spending 10 years outside and
Yeah.
dealing with whatever issues might have been there before they experienced homelessness that have been exacerbated, like there's a potential opportunity, right, that we could see some cost savings over time. I think we'll really have to get there, you know, we really do need to, I think you can't just invest on the front end and then not address the most acute. And then if you only address the most acute, but you're not dealing, so unfortunately, we do have to do both. I think the part here to mention too is like, while these do all have, certainly Safe Move is a significant investment for the city, these would be significant investments as well. There is a part here, like, all of these interventions do bring cost savings to the city, and like, I think we keep mentioning it, first responders. And so there could be some real savings there, or like, as opposed to, we may not see it on a budget line item, but if first responders are then more appropriately able to answer other calls, where is that a savings to the community, whether it's, we have an individual that first responders aren't constantly engaging with, that we can't meet their need, or like we've seen in the encampment decommissioning work, we don't have first responders that are constantly responding to a site with, police and fire calls. So I would say I think that we can get there. Certainly if we can make these investments over time, that, there could be an opportunity to scale down a little bit, but it's pretty hard to predict that.
Well, but I think she's on to the ROI, the return on, we keep talking about that. It's like, okay, if we're investing $1 million, what are we getting in return? And whether it's in savings over here or whatever, it's a lot easier to,
Weigh it out.
And justify if we're increasing a budget, well, here's what we're getting in return, right? So I think that type of analysis, even if it's an estimate or whatever, based on what we know so far today, is super helpful.
And I would point out that we have that estimate for the crisis system work, which is on that sheet in front of you.
Yeah,
488,000, I think, is the savings.
that's great.
Yeah.
Maybe if you could give us, I love your fact sheets, they're one page. Know where you learned that. Something like that, I think, would be helpful because this is a complicated system, and I appreciate, this is what excited me, was this all made sense, the way you have it laid out. But maybe doing this, if you invest here, we save here type one-sheeter would be helpful for us,
Okay.
Emergency room cost, EMSA,
all of that.
Providers going out to mitigate an episodic event or crisis, what does that look like when the Mental Health Association might even partner and intervene in a situation, and what does that cost? And,
I think the clearest one actually where we have overlap between like the investment in the 911 call center and Safe Move Tulsa,
Yeah.
the very first one is the first responder time save. Like,
Right.
Riverside Patrol talk about how much they have had to spend less time at some of the encampments on Riverside since those have been decommissioned. You have the same thing on, we haven't actually done a cost estimate. I know we have like an hours weekly estimate, and you could certainly put a dollar amount to that. But I think, if we can put our heads together and try to think of like what that ROI is. And there's some on like homeless services, like the cost of housing versus emergency services. I think this is something you're kind of hitting at the crux of it in many communities. This is even at the federal level. You have HUD and you have SAMHSA and Mental Health Abuse and Home, Health and Human Services. At the federal level, state level, and local level, all of these things are kind of seen as different pillars, and what we're trying to build at the local level is that integration. So we might have to cook something up here a little bit.
We do have this research here on the FACT teams, which show they have a 1.5 times return on investment. That's from national studies.
That's great. I'm so sorry we're out of time. I know we could spend 2 hours talking about this, but I really appreciate you coming, and just encourage counselors to reach out to them. I know you have a lot more questions too, and people had to leave for other meetings, so you guys are our experts, so we really appreciate you being here. Thank you.
Thanks.
thank you.
And with that, we're adjourned. Lori, how much time do we have?
Large.